Hello and welcome to the next instalment of our video series on A to Z general podiatric conditions and complaints. And today is the turn of O. And for O we're doing osteoarthritis, which is known as the wear and tear arthritis. And it's where the cartilage actually breaks away, wears down, and you get bone on bone contact. Now this usually starts out quite slowly and worsens over time. And it can occur in any joint of the foot and ankle, but I commonly see it in the big toe joint, the first metatarsal phalangeal joint, so the big one that does that. It usually starts as tenderness, achiness, bit of joint pain, quite insidious really the way it creeps on, and over time it gets a lot worse, it gets a lot more painful, and you can develop joint changes, so you can get a bunion, you can get a bony lump, and some people get a big lump forming on the top of the joint there, and it can cause problems called hallux limitus, which is where you actually get restricted range of movement of that joint, it's not moving as it should do, or hallux rigidus, where that big toe joint really does not want to move much at all. And these can cause their own problems. You can get compensations in other areas of the feet, so start getting joint pain or even arthritic pain in the midfoot or the ankle, and you can develop corns and calluses where the foot isn't functioning properly. Now, it is thought to be age related, but it can be brought on by previous injury to that joint. Increased body weight can make it worse. A family history of osteoarthritis does make you a bit more prone to getting it, unfortunately. And it can, in the foot, also be caused by poor biomechanics, so the way the foot is actually functioning can actually be contributing to that. Now, there are ways that we can look at to try and help this, and the first one is footwear, appropriate footwear, especially with osteoarthritis of that big toe joint. Heels are a big no-no when it comes to that. So footwear choices are very, very important. And you can take painkillers and non-steroidal anti-inflammatories as well to help manage the pain. Sometimes orthoses and insole in your shoe can help, and it can actually help either maximise the amount of movement that you have there or try and splint it to stop any painful movement. And exercises to try and keep the mobility and the flexibility around the joints as good as possible. Now, moving on from that, you get your steroid injections, so that helps manage pain and can help you exercise and mobilise the joint without any pain. And if all those have failed, I'm afraid you are on to surgery, and you can either get a debridement of the joint where they clean it out and kind of get rid of any mucky bits that are in there, or if it's a particularly painful joint, you will get it fused, so you don't get any movement in there anymore. And it's not very common at the moment, but it is coming in a little bit more, where you actually get a joint replacement of that first metatarsal phalangeal joint. So that is something that in the future might be happening more and more. Now, remember to keep an eye on NK Sports Podiatry's page, because they are doing their A to Z of MSK podiatric conditions and complaints. And if you have any questions, any queries, anything you'd like to ask me, pop it in the comments below.